Okay. First, I'm going to be doing the Lachman's test, and I'm going to have the patient lay down. I'm going to put my hand on his thigh, and I'm going to put my other hand underneath his calf, and I'm just going to be pushing on the thigh and pulling on the calf. And if there's any movement of the tibia, this indicates an ACL sprain. Next, I'm going to be doing the prone Lachman's test. Lay on your stomach. For this one, scoot. For this one, I'm going to be pushing on that calf. And if there's any movement of the tibia, this indicates an ACL sprain. Lay on your back. Next, I'm going to be doing the Lever's sign test. I'm going to have the patient lay down, make sure his leg is straight, and I'm going to be putting an object, or in this case my hand, underneath his calf, and I'm going to be pushing on his thigh, and if there's no movement with the calf, if there's no movement at all, this indicates an ACL sprain. Next, I'm going to be doing the anterior drawer test. For this one, I'm going to feel for those ends of the bone and put my hands there, and I'm going to pull that leg, and if you see any movement of the tibia, this indicates an ACL sprain. Next, I'm going to be doing the lateral pivot shift maneuver. For this, I'm going to have the patient lay down on his back, and I'm going to start with his leg in extension, and I'm going to move it to flexion. So I'm going to have his foot internally rotated. I'm going to feel right there on the bones, and I'm just going to flex, and if there is any visible palpable shift, this indicates an ACL sprain or an anterior lateral rotator instability. Next, I'm going to have the patient lay on his side.
This?
Yep, and then that. I'm going to have him put his first leg forward, bent like that. This is the Slocum test. And I'm just going to be feeling for if his subluxed knee has a decrease in flexion. So I'm just going to be pushing on the knee. And if there is any decreased flexion, this indicates an ACL sprain or an anterior lateral rotator